I'd love to introduce my friend and my coworker, Alicia Curran. She is the mother of a 20-year-old autistic son. Following her son's diagnosis of autism, she devoted her professional career to work within the autism field. Currently, she works at the University of Missouri, where she is the Director of Operations of the ECHO Autism program, Program Manager and Quality Improvement Lead for the Autism Learning Health Network, and the CDC's ACT Early Ambassador for the state of Missouri. So I welcome Alicia now to share some information about her story as a parent.
Great, thanks, Melinda, and kudos to Dr. Sorensen and Clary's, because I almost feel guilty because I'm going to repeat a lot of what they said. But it was very validating that my presentation was right on point. So, as Melinda said, I have a 20-year-old with autism. I'm 5'3", 150 pounds. He is 6 foot tall and 260 pounds. So as you can imagine, there's a little bit of a size difference, and he is extremely aggressive. Sam has low communication, and a lot of his aggressive behavior is due to that lack of communication. But he also has several co-occurring medical and psychiatric conditions that also fuel aggressive behavior. Most of the time, he's a lovely individual who inspires me every single day to be a better person. And, you know, the fact that he can wake up in the morning and be, you know, a fairly happy-go-lucky guy, and funny and creative on a lot of different levels, really inspires me, because if I had all going on what he does, I would not be a happy individual ever. So, you know, these incidents are few and far between, but let me tell you that they are so impactful, not only on him, but our entire family, my daughters, my husband, and me. So I said before that Sam was had a lot of co-occurring medical psychiatric conditions, which means we're a frequent flyer of medical services. So there's a few things that I'd like to share with you that have really like a couple of things. Number one, kind of thinking about where a parent might be when they come into your healthcare system or your facility. And then also some really kind of core things that have really made our experiences more positive. I think the first thing, which I tell clinicians all the time, is just meet the parents where they are. Parents are going to be at different levels, you know, and remembering that if there's a crisis, the patient isn't the only one in crisis. The whole family goes along with that crisis. Some days I am pretty good and I handle it well. Some days not so much. So meeting me where I am is really, really crucial. And I think that both Dr. Sorensen and Clary's has really communicated that through their presentation. It really starts with that relationship building right off the bat. It has to be quick, but it's critical, especially if they've, like Renee said, they've had that prior negative experience. It's really, really important that you quickly are able to bond with them. And, you know, valuing their expertise. Oftentimes parents are intimidated by physicians or healthcare workers, and knowing that they are, you know, that a crisis team can value their expertise is really, really essential, because that lived experience, it really is a piece that is missing in a lot of teams that care for individuals in a crisis with autism. And know that the family is an expert in their child. We can interpret our child's behaviors, their communication, their actions, and that makes, you know, working as a team really works well. Just before, when Renee was presenting earlier, I was getting a lot of text messages from Sam's teacher. And he said, Sam has put his head through the wall 5 times now. Not sure what's going on. And I said, oh, well, did he shake right before he did it and then start hitting his head? And he's like, yes. And I said, well, that means that he's really ticked off and he's mad at something. So what triggered that behavior? And he's like, oh, well, it was computer time. So again, I was able to tell him, oh yeah, that means he's really ticked, and give him a few strategies to use to extinguish that behavior, which I just got a text a few moments ago that it was successful. So we can help. Working as a team is always better than working solo. And then also engaging the family at the level they're comfortable with. Again, sometimes I want to be engaged. I want you to ask me questions. I want you to, ask my opinion and partner with me. But there are other times that I just need you to drive the ship because I'm broken and I'm tired. And it's really, really painful to watch your kid in a crisis and you can't help them. And so, figuring out what level they want to be engaged and don't assume. When people find out what I do and who I am, oftentimes I can kind of get left on an island. No one comes to help because she can always figure it out. But remember, there are times, even if I don't look like it, I look like I have it all put together on the outside. I may be crumbling on the inside. And so I think that's really the key to working with many, many families. It's not unique to just me. And explaining things, if there's a situation where I'm not really understanding what is going on, I think explanation for parents is really, really important. It has always made it, again, it's kind of that mutual respect and valuing my opinion and working together. That teamwork is just really essential, and me feeling that valued medical team partner is really important for me. And, if it's that, hey, mom, can you help do this? Can you help do that? But then on the opposite, hey, mom, I think there's a problem. And like, I'd really like, you to be maybe outside the room so we can get some things done, and just explaining your rationale. I think really just, again, it really fosters that mutual respect. And I will say for a kiddo who does not have great communication, please don't ever let low communication fool you. And I think we've already had this alluded to, but I want to reiterate, it may be different ways that you have to communicate to an individual with autism who has low communication, but they hear you. Sam surprises me all the time, and he hears way more and understands way more than I would ever expect. And I think, as they are a person and they're there for help. And I think explaining things just as you would anyone else is really, really a matter of respect and helpful. And they feel valued as a patient as well. I will also say, looking beyond the obvious. Again, when kids are in crisis, families are in crisis, right? And I think this holds true for us all assuming why a child is acting the way that they are, why a parent is acting the way they are. Don't always assume, because usually what looks like the very obvious things is not it at all. And stress can really affect a parent's demeanor, their memory, their effective communication. This is true for the patients as well. Dr. Sorensen has said that to us. And a behavior crisis, again, really makes parents feel helpless. It's really, really hard to watch Sam be self-injurious or aggressive towards others and not know how to help him stop that, or not know how to help him avoid that. It's really difficult. It generates a lot of guilt. Gosh, if I just would have done this, if I just would have done that, it generates grief. And that sense of helplessness can just really be difficult for any parent, regardless if they have autism or not. When you're feeling helpless as a parent, it's really difficult. So, when we can team together, I think that's a big point of when we can team together, that kind of lessens that helplessness. So also, remembering that when you're under stress, families may not be able to communicate exactly what happened. I kind of give a broad stroke rundown of what I think happened, but it may not seem like, geez, that's it. Like, that's not too bad. Or, oh my gosh, like, what did you just go through? So, remembering that how a parent explains in the moment when they're in stress and in crisis and their child's in crisis may look different than if you were actually part of the situation, and having that empathy, and again, it just ties back to meeting them where they are. That's really helpful for me. And then also remembering that our perspectives as patients and families is really based on our experiences. Some families are more resilient, they tolerate situations better, and then some families are just in survival mode. I've been in both places. COVID put me in survival mode for months after months after months, where I felt completely helpless and scared half to death to reach out for help. It's really hard for me to reach out for help as a parent anyway. I manage Sam's behavior like a boss most of the time. But when I can't and I reach out for assistance, that's a big deal. And I have done that before, and I didn't get the help that I needed. I think it was Renee, you said, parents need to be heard. I was not heard. And I was told that Sam just needs to increase behavior therapy, see his psychiatrist in the next couple of days, and he looks good right now. That was after he had me pinned down on the bed. And that was the first time I thought, oh my God, I think he might be able to kill me one day. Like, it was scary. It was really, really scary for me. So I took him home, and what happened as soon as we walked in the door, he started to get aggressive again. And luckily he was so tired that he fell asleep, and I was able to, manage that. But during COVID, I'll be honest with you, that prior experience really was a big barrier for me to reaching out for more help, because it was just a negative experience, and that it sticks with you. And also remembering that families typically have a lot more going on than meets the eye that stresses them. It's beyond the crisis, right? It could be a number of things. It could be something at work. It can be something with the internal family. It could be so many other things, financial, parents. It can be so many different things. So again, meeting them where they are is really, really crucial, and looking beyond the obvious to make those relationships. When we are valued and we are able to be engaged at the level we're comfortable with, that's when teamwork really is going to be most effective. So a few tips and tricks that I think have been successful. Again, we're frequent flyers because Sam has had every type of medical thing or psychiatric thing on the planet. So we've gotten lots of experience. And what are some key things that really work best? And really, Renee and Val have touched on all of these, but I'll reinforce it. I think, to avoid those behavior, it's a spectrum of strategies to make that effective, which is distraction to explaining in a variety of ways what's going to happen. So, and sometimes just distracting him for an IV, a shot, or whatever, if it's an iPad, if it's a show, if it's a come here and give mommy a kiss, come here and give mom a hug, just distracting him to look at something else is effective, but sometimes not so much. And explaining in a way, whether it's communicating, whether it's a social story, whether it's a picture, whether it's them playing, Sam being able to play with the tools, if that's available, just kind of seeing what it is. All of those things have been effective. It just all depends on the situation, and it all depends on how bad, if he's in crisis, if he's in a pretty good mood. There's so many factors. So, don't get frustrated if you have to try many things. Also, when behavior occurs, know that your reaction counts. it matters. When Sam is a hand flapper, and he'll get mad and he'll flap his hands, and then he'll get right up to me, just right up to my face. And if I flinch, it is highly likely I'm going to get hit. If I just stay still and like, whatever, usually he stops. It's not always the case, but that reaction can really provoke that behavior to escalate. And, remembering that these kids, kids with ASD, and when I say kids, I'm talking adults and kids, because they'll always be kids to me, have an atypical autonomic nervous system. And stress can really provoke them to get in that flight or fight mode where there's no rationale to them whatsoever. It's really tough to get Sam down from that point. However, I have discovered that the aggressive behavior that he has, him coming and attacking me, is a way of communication. It occurred to me this summer, when we had lots of these incidents, that I can help him get out of that flight or fight mode pretty quickly. He can't always do it himself, but I expedite the process. And so I think because I kept saying, he doesn't want to hit me. I know that he doesn't want to do that. What is this? And then I realized that the function of his behavior to come aggress at me was because I was going to come help him. And whether it was holding him, whether it was holding his hands back so he couldn't hurt himself or me, but that calm voice of "you're okay, you're not in trouble, you're safe," all those things were really, really great strategies. But it was really eye-opening to me that aggressive behavior was just, "Hey, Mom, I need help. I'm way up here and I can't get down, and I need you to help me." So I think that was a revelation for me as a parent, and knowing that might be the cause of aggressive behavior in an emergency room or a hospital setting. And then sometimes less is more. Again, if Sam is in a flight or fight mode, me handling him solo usually works out better than if my husband is coming in to try to help, because then that just escalates that stress more so for him. I think, again, I've said, to avoid behaviors, distraction to explaining, like it's a wide spectrum of strategies that we use. So I think you make a plan, but know that you may have to modify in the moment and be flexible. And we've tried several strategies to, get an IV or get a shot throughout the years, but now he's pretty good. Not all days, but, some days. So again, life's all about how you handle plan B. And I think that's true, especially and C, D, E, F in a moment of crisis. But the bottom line is, I want what's best for my child. It's so, so hard to watch him exhibit any of these behaviors at home. But then when you have a crisis, it's really, really difficult. That helpless feeling it can really, really be difficult. And, it really, provokes a lot of emotions. So knowing that if a family is disengaging, it may have nothing to do with you. It may have everything to do with their situation. There's families who can handle a high load of stress and behaviors, and there's some families that cannot. It doesn't mean that they're a bad family. It doesn't mean that they don't love their child. There are so many factors that go into that. I thought I had a super cape until COVID happened, and then realizing that this chronic aggressive behavior was really, really difficult. And then managing the meds and trying to we ended up in the ER a couple of times, sometimes me, sometimes Sam. But it really is, it's stressful. And even with what I do and all that I know, when we go into these situations, sometimes my mind goes mush. Sometimes I feel like I'm being judged. I feel like a bad parent. that I couldn't stop Sam from hitting his head so hard that he's busted it open. And I'm not a head doctor. I'm not a doctor at all. So I needed to get that checked out. And so, I felt stupid for bringing him in when I thought he was okay. But at the same time, Sam can't communicate exactly his, sometimes his wants and needs. So I felt obligated to bring him in. But I kind of felt judged because literally they did nothing but send us home. And which was a relief to me because I was so glad that, nothing was wrong with him. But it's a challenging time when families are in crisis. And so having empathy, valuing them for wherever they are, and looking beyond the obvious, I think are key components that you can utilize with every family to give them the best individualized care as possible. So I hope that is hopeful it's just one mom's experience, but I will say that I worked in the severe behavior room in the school system for a long time. So I've seen kiddos with severe behavior for a number of years, not just my own. And I can tell you that the strategies, the most effective strategies and functions of behavior and all the things I just talked about are true for so many kiddos. Everyone likes to feel valued, and everyone has we all prefer things differently based upon our experiences. So thank you all for all that you do. I really appreciate you being here because this tells me that I have a lot of team members around the state of Missouri who are interested in learning more to support not only my family, but the families of Missouri and beyond. So thank you so much for being here and having me.
Thank you so much, Alicia. I think Renee or Val have noticed a question or statement in the chat, and one of them will be addressing that. We really appreciate your time and your wonderful story, and thank you for being here.
Quick, I want to say to Alicia, I think those visits when they send you home because there's nothing wrong, that's what we call those peace of mind visits. And they're important to families because again, their children can't, if your child cannot communicate to you and you're unsure, just that second set of eyes to validate that he is actually okay. There doesn't seem to be anything concerning. They're not seeing anything. We call those peace of mind visits. And it's important. So in our chat, we have a statement that is, I think it breaks my heart, and we see it too. So we frequently have families come to the ED seeking respite, and after an assessment, we determine that our ED behavioral health or inpatient resources may not be adequate or appropriate for the patient. I feel we have a gap in the resources here and feel awful for the family and the patient. What can we do for these families seeking help or respite? And, this is I think this is where we all sit in this gap of how do we help? And I don't have a perfect answer for sure, but I think, when we as providers recognize that gap, we need to bring that gap up, and we need to bring it forward to people who can help us figure it out. Because not one person's going to do that, but it certainly doesn't get figured out if we sit on it and don't say a thing. Sometimes we have kids get admitted for respite to the hospital. They try not to if they don't, but there are extenuating circumstances at times, and they will occasionally do that. And again, we do have a system that they feel like can care for the kids. But I think we have to be open. If we say that our system can't adequately or appropriate care for the patient either, think about if we as a team of professionals who are highly trained can't do it, how do these families do it every day? And I think that's the compassion to me that has to drive us forward to make this better. And we have our autistic individuals are not immune from having their own psychiatric challenges and needing the same kind of psychiatric continuum of care that other people need, yet we have very few inpatient stabilization programs for people with autism. And I think we did develop one here at Cincinnati Children's, and it is always full. And it serves a huge community service to these families and to stabilizing and getting. And it's not in and of itself, it's not enough. Like, we're still building our outpatient services to adequately meet the need too. But I think, it's important to, hospitals can take a big stand in pulling together stakeholders for this population and getting people together at the table to say our community has a gap here and we need to do better. So pulling in the specialty services and all the different services to take a stand. I think it's hard. There's so many things to tackle. And as a hospital, there's so many things to tackle. But what I know is when I arrived at Cincinnati Children's, I think, it was 1 in 1,000. And we thought that was a big jump for the number of kids with autism, right? And, now it's so exponentially bigger. And what I know is that all these kids that were diagnosed, through my 21 years are now starting to hit that adult system. And this adult system is also going to go through this huge transformation that we've done in pediatrics. So, I think that, engaging our social workers, I know we have a few on this call, in the emergency room or in these respite situations, engaging our hospital leaders to say we have the situation come through. We're seeing more of these data to start to track that situation, to start to show that it is a challenge. We're seeing this on a pretty regular basis. If these folks don't get the help they need, they can easily get abandoned at the hospital, and often the hospital will have to admit them, and then they sit. And so that's another thing that we have occur. And so again, this community getting together to figure out the resources around this population is important. So I would just encourage you not to sit on that knowledge, but to be the squeaky person who just continues to bring it up and to try to frame it and to bring it get the right stakeholders at the table to start to look at those gaps. So not a quick answer, not a fast answer, but I think we have to just keep bringing it up. Along that line, we have on echoautism.org, there are the different ECHO model programs that serve individuals with autism. Yeah, here's our slide. So I belong to the ECHO Autism Crisis Care, which kind of makes sense. So we're doing crisis here. And you're all invited to join any of these ECHOs that would serve you in helping serve the population. In our crisis care, we did actually set out to have it include folks from emergency rooms, hospitals, as well as our community. And I think what's hard for our hospital folks is we meet twice a month, and it's hard to have the time to meet 90 minutes twice a month. And because many of the case presentations are about kids in the community, maybe it doesn't feel like it's a good use of time. So we could develop an ECHO autism kind of crisis work, systems work, and also look at case-based learning for hospitals if folks were interested. And that could be monthly, it could be quarterly. And there is going to be a question on your survey at the end of this presentation. And if you're interested in something like that, do let us know, because we certainly do know that our hospitals struggle with this area. I also part of the pioneer cohort in Solutions for Patient Safety that is working on what we call patient behavioral events. It's not specific to autism, but it is specific to any patient, no matter what, who has a behavioral health kind of concern in the hospital, and developing programs like the behavior safety team. And hospitals are invited to join those types of teams as well, and it's all quality improvement work. You did put the poll out. So there is the poll if you'd like to select on that quickly, if you'd be interested in doing an ECHO autism kind of tele-ECHO program to work on building on the hospital system for autism. And truly this work can work for all behavioral health patients, but you do have to have a special eye for autistic patients, because they have this unique set of needs, and the language components are so significant for them. And then if you can answer that poll for if you'd be interested in that, and if so, would you prefer it to be monthly or quarterly? If we have enough interest, we're certainly happy to continue to develop these models. Again, the ECHO model has the hub set of experts who are going to be there each time they present, and then we have the different folks who are providers present either a case, or in this case, it'd be like a case or a systems kind of concerns, and get feedback from this hub team of experts. But they also get feedback. It's all teach, all learn. So everybody can provide input to the case consultation. And additionally, we tend to have didactics on the different things that are important to this work. So it's a great way to kind of share and learn from others and have specifics. Our solutions for patient safety is great, but it's a lot bigger. And so doing an ECHO kind of side thing would help, I think, dive deeply into specific areas of question that folks would have. So it would provide a different resource as well. So I don't know if you can pull up from that. Are there more questions from our folks? Oh, my cat Louie is going to make an appearance right now. Thank you, Louie. At least he waited to the end.
I don't think so, Renee. I think I'm looking through the chat just to see if I missed something. But I don't believe so. There are people thanking about and just important discussion, and just piggybacking on what you said before, a squeaky wheel gets the oil, right? We need to bring issues up and make sure that we do. You know, and I can't stress that enough. You know, thank Alicia for all that she teaches us all the time. I'm always in awe of how much I learn from you, Alicia, and you know, it inspires us as professionals to do a better job at what we do, and trying to figure out ways to make sure that we prepare ourselves, our environments, to really meet the needs of people with autism and other challenges. So thank you for sharing that, because it always inspires us to be better and try more. There's so much more that we need to do, right? So thank you.
Like I said earlier, we're also planning an in-person training if we can swing it, if COVID relents enough that we can do in person. If not, we can still do virtual, but we think that there's a lot more benefit to think about in person with a little bit of team and interventions, and using some of the tools that we described today, kind of demonstrating some things, and having people be able to look at stuff hands-on. But if you're interested in something like that, or would have additional topics that you would like covered in that kind of a training, please put those out there, because we always want these to be towards what you need in your individual hospitals. And everybody's on a different journey, and hospitals are quite different. I mean, they have similarities, but there's a lot of individual difference, just the way they're built and served, and how the leadership and culture is. So never hesitate to call out the specific things that might help.